Hey JamRock Islanders, thank you for joining me today. I'm so happy that you are here. Thank you for your support so far. Today I'll be going over some questions that I've been getting, like what do I use to give medications in the hospital? How do I chart? What is the program? What are the programs that we use? And so I'll be answering your questions based on my experience in different hospitals, in different states, and I hope that it will be beneficial to you and others that are related to you in some way or form. For those who have been here supporting me from the beginning until now, I thank you. I appreciate your comments and your support, and I look forward to our long-term relationship. For those who have been here for just the very first time, it's not by chance. You should be here, and I'm happy that you are here with our family today. You are loved and appreciated, and I hope that it will be a benefit to you also. So remember that at the end of our video, we normally do a 360 buzz, and I want you to stay tuned for what I will be sharing with you today. Remember to like, share, and subscribe to this channel so that you'll be able to know when I post a video or I'm doing something live that you can join. And I'm just happy that you're here with me today. So let's get right into the video, shall we? Thank you for joining me again. So I'll get right into the content. So first of all, what do we use to chart our nursing notes or assessments? What do we use to chart different things? That's what I'm gonna deal with number one. All right, so at the hospitals that I've been to so far, we have been using, for the top three softwares, you have Epic, that most hospitals are going to. You have Cerner and you have MEDITECH. Those are just different softwares that you use to chart your assessments, your notes, transportation for patients. You can do it there, and every hospital will give you a orientation on whichever software they're using and a test to make sure that you are able to do the basics, and that you will also learn when you go on job. So even if you pass the orientation and you're like, I don't remember what I've learned, Epic will do that for you. It did that to me. Like, it's a lot, but once you start using it, it's really easy and really simple, and to me that's the best one I've been using so far, Epic, and other systems are turning over to it. MEDITECH, it's a good source, but it's a little bit old-fashioned. Not to step on anybody's toes, but it's a bit old-fashioned to me. I've never used Cerner, but I hear that it's okay. So those are the three systems I've heard of. There is more, but those are the most used softwares that you use. So for the assessments, it's not like Jamaica that you have to write in a docket to say receive patient at this time, and you have to write out all the assessments. In these softwares, you will have like respiratory, cardiovascular, musculoskeletal. It goes by systems, and you click on it and it will give you the option. So what you would normally write in the notes is what you'll be clicking on. So whether the lungs are clear and bilateral, or it has crackles, or you just click on the option that you need to click on, and it will tell you what you should do, how you can do it. If you don't know, just ask someone who has experience and they will help you along. And as I said, as you use it, you will be able to go through it. No time. Assessments done, no time. The hospital will tell you their policy on how often you should chart a full assessment, how often you should chart a focus assessment. The computer system itself will tell you when you are supposed to chart. So for Epic, It has something called the brain. You can do everything on the brain. It shows you medications, when it's due, tests that are coming up. It will tell you your assessments that you need to do that is outstanding. So for example, if you need to do a fall assessment on your patient, or you need to do a respiratory assessment, or you need to do an assessment to say how the patient moves, how the patient walks, if it is due at a certain time, it will pop up to say you need to do this assessment now. So it's really simple, really easy, and it will help you to say, okay, you don't have to say, okay, I need to do the assessment right now, I don't know what to do. The computer will show you even medication that's outstanding. I know MEDITECH and Epic and Cerner have their different versions, but for the versions for MEDITECH that I've used, it will tell you what medication should be given at what time. So if it is due, or if it's like now you're supposed to do it, it will pop up and say, okay, you're supposed to do Tylenol, or you're supposed to do Reglan at this point in time. If it's overdue, it will pop up in a different color to say it's overdue, you need to give it. So don't worry about it. It will show you what to do. For notes, for me, since I've done all the assessments, I don't normally write a note to say all of what I did already. I mean, it's already in the computer, so I don't need to rewrite a note to say it. Some people do, but I don't. I just think that's double charting. If something happens, like it's an emergency, you write a note to say to cover yourself. But apart from my charting my full assessment, the only notes that I write is something that is outstanding, like I called a doctor to do something. And the Epic that I'm using now, it actually has a part that says provider notification. So sometimes you don't even really have to write a note. It says which provider you call, why did you call them, what time, and there's options, and it will say, all right, what's the result? Did they give an order? New order? No orders? Wait for orders? It gives you the option. So you just click on whatever you need. So that's basically an overview of the systems. Epic, Cerner, MEDITECH. There are others. I don't know how they look, but I can just tell you from the experience that I've had with Epic and MEDITECH, and from experience of others using Cerner. So for the second thing that I've been covering, and the last thing, is what do you use as pill dispensary. So we know that in Jamaica, we normally take our pills out, count them out in little cups, distribute them. We have to know and make sure that it's correct. Like there's no computer telling us this. We have to just read the orders in the docket and just give the medication. But for here in the hospital so far that I've been, there are two main systems that I've used so far. One is the Omnicell and one is the Pyxis. It's the medication dispenser system. So you go there, it automatically uploads and have your patients in the computer on your unit. And you go there, look for your patients, and you will see the medications that they're supposed to have. Sometimes it will, in Pyxis, it will tell you the ones that I've used so far. It will tell you what is due. So for 10 o'clock, it will tell you what it's due. For 9 o'clock, it will tell you what it's due. And you choose from it. Sometimes not all the medications are there. You still have to go back in all the medications and choose. But the point is, the medications are on the screen. You should know what is on the MAR. The medication in the computer will tell you what you should give. You make sure you know what it is, and you just go and click what you need and release, and it will pull the draw out. You choose what you want. Now for narcotics, if you need to waste something, so for example you need to give 2 milligrams and give 1 milligram and it comes in 2 milligram, it will tell you that you need a witness. So you get the witness say, okay, you're gonna throw away that 1 milligram. The person put their fingerprint in or their password or whatever they need. You take the medication, waste it, and that's it. That's how you are accounted for in the for the narcotics. The charge nurses now go whenever in the midst of the shift or at the end or whenever they choose fit, and will just go and do a cycle recount of every medication that's in, make sure it's correct, and get the witness and all of that. If you're not a charge nurse, you don't have to worry about that, unless pharmacy tells you that, okay, you didn't give a medication or they're not sure. So for example, for me, the other day I needed a medication. It was not in, but it is saying medication is in there. I had to call pharmacy. They said they would send that medication, but I need to do a cycle recount of that medication. That's pretty much the one time off thing that you need to do a cycle recount to say how much medication is actually in the drawer for a pharmacy to know that they need to refill it. But apart from that, the charge nurses do it, or people from pharmacy, the techs will come up and do that for you. So it's really easy and really simple for you to do. The medication is there. You just choose your patient's name, choose what medication you need. It will pop out. Make sure you choose the right medication. Look at the patient's medication, because as I said, it's machine and people are coming up to fill the Pyxis or the Omnicell, and sometimes they will put the wrong dose in the Pyxis, because I've had many experiences where when I take the medication out, or I go in the patient's room and I scan it to give to the patient, because in order to give a patient a medication, you have to scan the medication to say it's the right medication, it's the right dose, it's the right patient, and it will allow you to do it. It's the wrong dose. It's the right medication, but it's the wrong dose in the packet itself. So just be careful. Make sure that you look at the medication, make sure it's the right medication, make sure it's the right dose. And for example, for the example that I gave a while ago, it was the wrong dose. I had to call pharmacy. They have to come up, do a cycle recount, take the medications out, restart the drawer. Make sure, and on a side note, make sure that you are scanning your medications. Don't just take it for granted that it's in the Pyxis or the Omnicell and you take it out and it's the right medication or it's the right dose, because it's technology and it's still people that we are working with. So make sure you scan it to know that it's the correct, because if it's not the correct one, the when you scan it, the computer will flag you to say it's the wrong medication. So don't take it for granted. Make sure you scan it, because once you give that medication and it is not scanned, and God forbid it is not the right medication, it may harm the patient, not immediately but after, and you will get into trouble. So make sure you scan all your medications, and even when you scan them, look at them to make sure that it's the right medication that you are giving. So I hope that I've answered your questions. The systems that we use to chart our assessments or notes, you have MEDITECH, you have Cerner, you have Epic. And for the pill dispensary, what we use, I've seen being used, and what I've used is Omnicell or the Pyxis, and to be honest, I prefer the Omnicell. Somehow, some way I prefer it. But those are the things that we use as nurses in the hospitals to give medication to chart. And as I said, I hope that it is beneficial to you. If you have any questions, please put it in the comments below and I will answer them as best as possible. If it's not related to medication dispensary, any questions that you have related to nursing, just put it in the comments below and I'll answer you as best as possible. And I thank you for your comments. Okay, now we go into our 360 Buzz segment, and today I will be addressing, it's not a funny thing, it's a serious thing. When we have our dementia patients or patients with altered mental status, patients that are not coherent, not oriented to what is happening, please make sure that if it's the male patients, please put the urinal not on the table. Not on the table that they eat. There are many instances that the urinals are on the table, and because they're not in their right mind, they will drink the urine. That is not good. We don't want them to drink their urine. We don't want them to take it with pills. Some of them will just take it up and drink it with the pills. Some of them will just drink it when you're not in the room. Just put the urinals somewhere that they cannot take it to drink it, or as soon as they use it, you check on them often, empty the urinal, so that they won't be able to do that. So yeah, that's the 360 buzz. Just be careful. I know that we have a lot of stories where patients do that. We don't want that to happen. So just nurses, be careful where you put your urinals. Make sure that you put them in the right places so that they will be able to not take it up and drink it, because we don't want our patients to do that. So that's a wrap for today. I hope that you have been benefited by what is said today and that you passed it on to others. Remember to like, share, and subscribe to this channel, and see you in the next video.